it all started about 30 years ago when I was on call, and there was a patient with a loss of vision. She thought was a contact lens issue, and then from there on, they found a retinal detachment, sent to me. I took care of her, did a sclerobuckle. That was 30 years ago, and 30 years later, the parents wanted to honor me with the gift, and we started talking about. They knew I had several research projects going on, but I could clearly see that they're a family of 5 children, very much devoted to educating their children, and so one thing led to another. They knew how much I was into teaching, particularly working with residents and fellows on sclerobuckle, the procedure that helped their daughter to regain her vision. And so this led to the wonderful surgical training lab that you just show everybody. And it was just when young Kelstra and we were residents, so we had a closet, basically, a little closet where we had devoted attendings who spent some time with us, but it was in a little closet. And it was just amazing what the facility that we have now for residents and fellows.
I feel like we are so lucky to have these resources available 24/7, whenever you want, in the middle of the night, if you're on a night shift and you want to just wind down by doing some extra, practice, you can do that. So I think it's such a wonderful thing. I'm really happy to talk about this. So the I&I sessions are specific, dedicated sessions that stand for innovation and interaction. We do them the first Friday of every month, and it's usually 3 hours of time dedicated to resident surgical teaching, where you are exempt from any clinical responsibilities. I mean, if you're a primary surgeon on a case, you should probably do that instead, but otherwise, all years, junior, intermediate, senior, all come together and have a tailored curriculum to their level as well. So there's usually a theme. So there may be a cornea theme, or doing penetrating keratoplasty and corneal transplants. And the level of things taught will kind of be tailored to the level of resident as well. So really you get the most out of it. And I think even just practicing suturing and putting in corneal sutures, realizing the tension and strength of a 10-0 nylon suture, and just being able to sit there and pass suture. Oftentimes you're paired a senior resident and a junior resident together, so that way the senior resident can pass on tips and tricks. And the senior resident learns a little bit about teaching, I think, and maybe notices things that they may do even inadvertently. So I think so much comes out of that. A couple of specific I&I sessions that have been great. So cataract teaching, and again, as a junior resident, you practice making wounds, and good wound construction is really important. And then you can get into the intricacies of nucleus disassembly. And more recently, we had a session on complex cases, Malyugin insertion. We've had glaucoma cases, putting in tubes, practicing trabs. We've done scleral tunnels, and so many. I'm sure I'm missing so many of these sessions. They're new. They were started when I was a junior resident and are just one of the best, I think, parts of being a resident here.
So for the plastics sessions, we want to have all 24 residents involved. And for each resident class, we actually have separate goals. So for the first year residents, the main goal of the session is to practice emergency procedures that they might find a little scary to do on their own when they're in the emergency room at night, like a canthotomy or acantholysis, and also learn some basic oculoplastic surgical skills, have an introduction to eyelid margin laceration repair, things like tarsorrhaphies, really have a good opportunity to ask questions without having an awake patient right there. And also learn a little bit how to assist in a surgery. For the second year residents, the goals are to do a little bit more advanced surgery. We'll practice things like ptosis surgery, dacryocysterinostomies, also facial fillers. And for third years, the main goal is to review the basics, also help teach the first year residents, and then try some more advanced surgical techniques like orbital fractures, enucleations, and then also learn how to coach your assistant through a surgery. So what we usually do for this is we pair the first and the third years together because they're used to working together in the operating room. The third years can help teach the first years while the first years can learn from the third years and can assist them. And we split the second years into a separate room. The focus of these sessions is just surgical technique and not theory. And the goal of this is to get as much hands-on as possible so that when residents are in the operating room, they're more comfortable doing things and attendings can really trust them to do more, and overall will have a better surgical experience. So in like non-coronavirus times, we usually break the residents up into two separate groups, the first and third years and then the second years. We actually make use of both our wonderful eye lab, but we also take over the ENT lab, which is on the same floor at the same time. We have cadaver heads for these sessions because some things like a acanthotomy and acantholysis, you just can't get that same feeling and that practice on something that's not human or not or just like a piece of chicken. You really can't get that same feeling and ask someone, am I doing this correctly or not? And typically in non-coronavirus times, we would have about a 20-minute lecture or so going over the surgical techniques, and then we jump into the wet lab to practice and then go back and forth. We do a few things like retrobulbar injections with contrast so that we can then put the heads through a CAT scanner to see where the injections end up. Are you in a good place or are you way off from where you thought? And I think it's been a very good success and people have really learned a lot from them. The other wonderful thing is that our oculoplastics attendings are all very involved in these labs. Typically, all of them will cancel clinic or delay their clinics for the day. So we really have a lot of fellow and attending supervision during these labs so that residents can get their maximal teaching in for the day.